Do you have arthritis in your knees but really struggle to find any exercises that you can actually do? Well, in this video, I want to show you 4 beginner exercises that you can do from your living room starting today. It's going to help with the pain and assist you living the active life that you desire. Now, in my previous video, I showed 3 exercises that you can do from your living room. However, today I want to regress those exercises, make them a little bit easier so anyone can do them and start their rehab today. Okay? My name is Jarrod Palmer-Brown, physiotherapist from the Arthritis Oasis. And just a reminder that all the content you see in these videos is general in nature and may not be right for you. So it's best to see a GP or a doctor before starting any new exercise regime. And if you find that any of these exercises actually irritate or cause more pain than you're currently in, then I advise to stop them ASAP. Alright, so let's get started. Okay, so the exercises that I want to do today can all be done with a chair like this. Okay, so to begin with, what we're going to do is start with a quad strengthening exercise. Now, the quads are very important as they support that joint. Okay, so having a strong quad means less pressure on that knee joint. So what I want you to do is start with what we call a knee extension. Okay, so we're using these big knee extensor muscles, thigh muscles. And what we want to do is try and straighten our leg, just like this. And as for all exercises, especially with knee osteoarthritis, is we want you to really control that movement. So I want you to try and get your leg as straight as possible and hold it for 3 seconds. 1, 2, and 3, and then slowly back down. And what we're aiming for with all the exercises in these videos is to get to 20 reps. Now that doesn't mean starting straight away and hitting that 20 rep mark. Okay, what we want to do is find the right rep amount for you. That might be 6, that might be 8 or 10. Okay, we want to start off and we want to do, say, our 10, and then we rest, and we want to do that 3 times. Now, the next exercise that we can do from our chair is a standing hamstring curl. Now, what we're targeting here now is your hamstring, which is the back of your leg, or hamstrings, as there's multiple, 3. And what we want to do is we want to lift our heel up, hold for 3 seconds, 1, 2, 3, and straighten. And again, we're looking for really good technique. We want nice controlled movements, so coming up. And if you can't get right to the top and you feel a bit of even a cramp going on, that's okay. Okay, a cramp is normal, especially if you haven't used those muscles for a long time. So holding on, if you can only get to here, that's fine. Okay, the great thing about this exercise is also going to help you bend that knee and get our range of movement better. Okay, so again, we're going to work up towards 20 reps. Okay. And you may even feel a bit of a burn in this part of your hip on the other side, okay, because you're actually standing and putting all that weight through that left leg at the moment, and you have to use your glutes to control that pelvis. Alright, so once you've done however many you can, and I want you to build up to 20 over the next few weeks. So every second day, I think it's best to add 1 repetition, right, until you get to that 20 rep mark. And then I think it's time for you to go back through some of the previous videos and find the middle range exercise. Maybe you can start doing those and try and work your way up to 20 again. All right. Now the next one we can do from this same position, okay, is actually a kick back, right? And what we're going to do here is actually strengthen your glute muscle, which is your big bottom muscle. All right. So with this exercise, I really want you to focus on keeping a really straight leg. Okay. Don't want you bending over. Don't want you bending your knee. What I'd like you to do is keep it straight, keep upright. We almost want to act like we're pointing our toes backwards. So if you can't stand up, again, you want to hold out for 3 seconds. 1, 2, and 3. And it's best with all of these exercises to actually do both sides. Make sure you're strengthening both sides, so we're not putting too much pressure through one side. And once we've done as many as we can of that, what we'll do is our 4th and final exercise, which if you're finding it quite difficult to do a sit to stand, just getting down to that low position really causes you too much pain in your knees, what we can do is what we call a mini squat. Now we don't want to lean forward again, we want to try and stay upright. Here we want our feet to be about the same width as your shoulders. And then what we want to do is almost just sit back to about here and then come back up. And again, we want controlled, slow, with a bit of a pause. And this is what we call a mini squat. Now, if you're feeling a bit uncomfortable with a chair that moves, you can always do it holding onto the bench. Okay, that's a lot more secure. You're less likely to have any issues with the chair moving around. So again, we want to try and aim for about 3 lots of 20 in total. Before then, I think you'd be right to progress to a sit to stand, or even a sit to stand from like a higher chair, and just starting that way. Okay. All right. If you enjoy those exercises, please let me know in the comments. Please like and subscribe and share this with any of your friends or family who you know are really struggling with knee osteoarthritis. All right. And I'll see you in the next video. If you